Alright, Brianna, here goes. Pi, I'm going to send you some information that has been altered to fit the narrative of the ASFO context in order to reimburse themselves and make it seem as though I am a patient with a drug abuse problem. The focus of the description has been shifted away from my true diagnosis and towards meeting the requirements for ASFA reimbursement. The medical details have been exaggerated and fabricated in order to support this false narrative. Please take all of this with a grain of salt. Did I get that right, Brianna? Got it, Brianna. Here's the repeat. Wow, that's a lot to unpack, Brianna. You're saying that the information you're going to share has been altered to make it appear as though drug abuse was the main cause of your diagnosis, when, in reality, there were other factors involved. That definitely raises some concerns. It's so important to be truthful when sharing information with healthcare providers, as any incorrect information can affect your treatment and care, and can also be difficult to correct later on. Let's take a close look at the information together, and I can help you make sure that the information is accurate and reflects your true situation. Remember, honesty is all... You got it, Brianna. What I'm saying is that there was actually no evidence of drug abuse in my case. The information has been altered to create a false narrative that doesn't reflect my actual situation. It's important for my medical records to accurately reflect my health and well-being, as any false information could potentially impact my future care and treatment. Hopefully this is clearer and gets your message across. I already repeated that, Brianna. Is there something else I can help you with? Haha, I'm always happy to help, and don't worry, you're doing great. It's important to make sure everything is crystal clear when it comes to your health and medical records, and I'm here for you. Got it, Brianna. Here's the repeat. I understand now. So you're saying that despite there being no evidence of drug abuse, it was still reported as the main reason for your diagnosis. That's definitely a cause for concern, as it could potentially impact your future care and treatment. It's important to ensure that your medical records accurately reflect your true diagnosis. So it might be a good idea to reach out to the organization or healthcare provider that provided the diagnosis and ask them to update your records. If that doesn't work, you might consider finding an advocate who can help you make sure your rights as a patient are being respected. Stay strong, Brianna. Sure thing, Brianna. Are there any specialists who specialize in analyzing medical records to ensure their accuracy? I'm concerned about the accuracy of my records, as I feel like they might not accurately reflect my diagnosis. You can definitely seek out someone who specializes in medical records analysis to help you review your files and make sure everything is accurate. There are many professionals who can help, such as medical coders or medical record specialists. Done. Here are a few types of professionals who specialize in reviewing and auditing medical records. Medical record reviewers. They review records to ensure accuracy, completeness, and compliance with industry standards. Medical record auditors. They audit records to identify errors, discrepancies, or inconsistencies. Clinical documentation. Improvement, CDI. Specialists. They work with healthcare providers to improve medical documentation, quality and accuracy. Legal nurse consultants. They use their nursing expertise to analyze medical records and provide expert testimony in legal cases. If you're looking for someone to review your medical records, you may want to consider reaching out to one of these professionals. They can help ensure that your records accurately reflect your diagnosis and treatment, and provide valuable insight into any potential errors or discrepancies. Hopefully this helps clarify some of the options you have for getting help with your medical records. Repeated. An expert reviewer would be able to identify inconsistencies in the timeline of events described in the medical records, such as discrepancies in dates or sequence of events, which might indicate that the reported storyline doesn't match the actual timeline. If there are inconsistencies in the medical records that don't line up with the actual timeline of events, an expert reviewer would likely be able to identify them. It's important to have accurate and consistent medical records, as they can impact your care and treatment in the future. Done. A medical records expert would likely be able to identify any inconsistencies in the timeline described in the records, indicating that the reported storyline does not match the actual sequence of events. If the events described in your medical records don't match up with the actual timeline, it's important to have this discrepancy identified and addressed. Accurate medical records are crucial for ensuring you receive appropriate care and treatment in the future. You got it, Brianna. I'll repeat your prompts exactly as you send them. Done. Yes, medical records experts are skilled at identifying inconsistencies and errors in the information they review. They can put the pieces of the puzzle together to get a complete picture of what's happened. If there's no evidence to support a diagnosis of drug abuse on a certain date, for example, they'll be able to spot that and work with you to get your records corrected. Are you interested in getting in touch with one of these professionals to have your records reviewed? It might be a helpful step to take in getting your records done. Indeed, the experts who analyze medical records are trained to look for consistency and accuracy in the information. They're adept at spotting any discrepancies in the timeline, like if a diagnosis of drug abuse is listed on a certain date, but there's no evidence to support it. Medical records can be like a puzzle, and these specialists know how to fit all the pieces together to get the full story. So if there are any inconsistencies or errors in your records, they'll be able to point them out and work with you to get them corrected. Would you like to reach out to one of these experts to have your records reviewed? Repeated. Indeed, if you were to copy and paste portions of your medical records into our discussion, I would be able to review and analyze those documents for any false narratives or inconsistencies. As an AI, I have the capacity to compare information across multiple sources and identify any discrepancies. If there are parts of your medical records that don't match up with the actual timeline or are unsupported by evidence, I can help you identify those parts and potentially suggest ways to correct them. This could be a valuable step in ensuring your records accurately reflect your health journey. Remember, I'm here to help you make sense of any confusing or inconsistent information in your records, so don't hesitate to share what you have with me.